Now I want to spend the rest of this talk on what is in the future. What are people working on to try and learn more about when it comes to spasmodic dysphonia? And the National Institutes of Health is the primary funding agency of biomedical research in the United States. It also funds biomedical research elsewhere outside of the United States. And two institutes at the National Institutes of Health, the National Institute on Deafness and Other Communication Disorders and the National Institute of Neurological Disorders and Stroke, both fund research related to spasmodic dysphonia. The National Institute on Deafness and Other Communication Disorders funds 9 grants, and this all developed within the last couple of years in response to the urging of Congress for this institute to fund more research in spasmodic dysphonia. And the National Institute of Neurological Disorders and Stroke funds 4 grants. Many of these are on dystonia, and spasmodic dysphonia is included in the family of dystonias. So this shows the 9 grants that are funded by the National Institute on Deafness and Other Communication Disorders. And I'm going to give you some highlights of these. Many of these are looking at brain function in people with spasmodic dysphonia and looking for also co-occurring deficits that might help us more reliably identify who has spasmodic dysphonia and who doesn't. NINDS also funds, as I said, the National Institute of Neurological Disorders and Stroke funds research on spasmodic dysphonia, and many of their grants are on dystonia, and spasmodic dysphonia is included in dystonia as part of the family of disorders relating to muscle activity abnormalities. So these grants are on dystonia and also relate to spasmodic dysphonia. As I mentioned, many of the grants are using brain imaging because there has been a rapid development of brain imaging techniques that are non-invasive and can be used with people to look at brain function while they're speaking or doing other activities. And this was a study that my laboratory and Christina Simenon did when she was with us at NIH. And we looked at which areas of the brain seem to be related to the symptoms in people with spasmodic dysphonia. And this is a little complicated, but anything that is blue shows up is different. That is, it is greater, an area of greater activity in people with spasmodic dysphonia in comparison with people without spasmodic dysphonia or healthy volunteers. Anything that is yellow is also different. That is, it's lower in the people with spasmodic dysphonia. That is, activity is greater in people without spasmodic dysphonia. So let's look at the blue areas because those are the areas that are more active in people with spasmodic dysphonia. The top line is showing brains of people with adductor spasmodic dysphonia, and the bottom line is showing people with abductor spasmodic dysphonia. And what it's doing is showing what is different. So here we have people with adductor spasmodic dysphonia while they are saying syllables such as E or C. And here we have people with adductor spasmodic dysphonia while they're whimpering, which is a non-speech task. And what you should notice is that there are areas of blue on both sides of the brain, and they're particularly also the same areas of blue when people are not speaking but doing whimpering, which they don't have any trouble with. Crying and laughter are less affected in people with spasmodic dysphonia. So this is the pattern in people with adductor spasmodic dysphonia, And this is the pattern in people with abductor spasmodic dysphonia. And you can notice that the areas of blue are very similar in both groups during speech, and they're also very similar in both groups during non-speech or whimper production, which suggests that those regions of the brain are abnormally active for people with spasmodic dysphonia all the time, regardless of whether they're speaking or doing other things. And in fact, that area of blue that's marked in each one of these brains is an area of sensory function. That is, it's an area of the brain that's active in response to sensory stimulation. And this might be sensory stimulation in the larynx. So this is suggesting to us that there may be some feedback from the larynx in people with spasmodic dysphonia that's heightened, and they might have increased feedback from the larynx, and maybe that's part of the reason that they have some of the symptoms. Dr. Semignon also related whether that increased activity in the sensory area was related to the severity of the disorder. And here is a measure of the amount of activity in that sensory area and the number of voice breaks that people with adductor spasmodic dysphonia had. And this graph suggests that the people who had more activity in that sensory area were also the people with the greatest number of symptoms. So this suggests there's a relationship between the abnormal increased activity in the brain and the number of voice breaks in people with spasmodic dysphonia. And this increase in number of syllables and the amount of activity in the brain was great whether you had abductor spasmodic dysphonia, as shown here, or whether you had adductor spasmodic dysphonia. That activity was greater than in the people who didn't have spasmodic dysphonia. Now I'd like to turn to another study that's ongoing. This is being done at Harvard and MIT by Dr. Frank Guthner. And he is an engineer, and he's developed a computer model of how the brain produces speech. And now he's trying to use his model to determine how spasmodic dysphonia might alter the brain, and then to see if he changes his model whether he produces the same symptoms as occur in spasmodic dysphonia in speech. So this will be a way of confirming some of the findings of the previous study that I talked about by Dr. Semignon, in that if they can find the model will produce breaks in speech by changing the brain similar to what Dr. Semignon found, then they will confirm that possibility that the brain activity in that sensory area is actually contributing to the symptoms in spasmodic dysphonia. Okay, there are some other studies that are currently being done by Dr. Semignon, who is now at the Mount Sinai School of Medicine in New York City. She's doing two studies. One study is looking at different neurotransmitters in the brain in people with spasmodic dysphonia using positron emission tomography. And one of the transmitters that she's looking at is dopamine, which is a neurotransmitter that's very important in the basal ganglia part of the brain and is abnormal in people with Parkinson's disease. And she has some preliminary findings that are suggesting that dopamine is different in spasmodic dysphonia than normal. Not the same as Parkinson's disease, but more in a different direction. And so this might suggest that this neurotransmitter is abnormal. And that kind of finding is important in the long run because it might help us develop new medications for people with spasmodic dysphonia. However, that's several years out from now. She's also trying to look at genetics in spasmodic dysphonia to see if there are certain brain imaging findings in patients with spasmodic dysphonia that can be associated with genetic abnormalities. Remember that diagram from Christine Tanner, who showed that there was an increased rate of some genetic possibilities contributing to spasmodic dysphonia. Now, Dr. Semignon is looking at brain imaging people with spasmodic dysphonia and trying to relate the brain function differences to possible genetic factors. Now, we've talked about some of the communication quality of life abnormalities that are affected by spasmodic dysphonia. That is, people who have spasmodic dysphonia have a disruption in their quality of life. And Dr. Baylor at the University of Washington in Seattle is examining and developing a measure of communication participation. And the first group that she's going to use this new measure on to try and determine how a disorder such as spasmodic dysphonia disrupts communication. I'm sure many of you could give her stories about that, but she's now trying to use a quantitative measurement technique to identify the amount of disruption in communication due to a disorder such as spasmodic dysphonia. And this will be very helpful in advocating to groups such as Congress on how disrupting spasmodic dysphonia can be to someone's life. Dr. Hood, who is at the University of California in San Francisco, Dr. John Hood, and a postdoctoral fellow of his, Caroline Niziolek, are both looking at auditory function in the brain and how that relates to speech in both normal folks without spasmodic dysphonia and people who have different speech disorders such as spasmodic dysphonia. So these are more preliminary studies being done to look at brain function in general for speech, and then to relate how that might be altered in people with spasmodic dysphonia. There is a study being done at the University of California in Los Angeles where they are trying to model the abnormalities in the laryngeal muscles in people with spasmodic dysphonia to understand what produces the breaks in speech. And so they have a three-dimensional model of the vocal folds and the laryngeal muscles to try and understand how they are disrupting speech. Now, there's also at University of Minnesota in the Twin Cities 2 studies that are ongoing looking at possible ways of diagnosing spasmodic dysphonia. And Dr. Peter Watson is trying to learn if sensory feedback is abnormal in people with spasmodic dysphonia. Remember the study that was done by Christina Semignon, where she found sensory areas of the brain were active, more active than usual. So Dr. Watson is now examining sensory function in other parts of the body to see if those might be different in people with spasmodic dysphonia. If he does find that, this might be a biological marker to differentiate people with spasmodic dysphonia from other voice disorders. And then Dr. Teresa Kimberly is studying the brain function for controlling the laryngeal muscles by stimulating at the brain non-invasively with magnetic stimulation and recording the activity in the laryngeal muscles. She's testing the same hypothesis as the results found by Dr. Semignon, if there is increased or decreased brain activity in certain brain regions controlling the larynx in people with spasmodic dysphonia. So we should know the answers to some of these studies in the next couple of years. And then finally, a study that I think will be very important is the epidemiology of diagnosis of spasmodic dysphonia and other types of dystonia. Dr. Carly Tanner at the Parkinson's Institute in California is examining patients who have been misdiagnosed and what happens to them. If they originally had, say, spasmodic dysphonia, but what misdiagnoses are they given along the way before they get the correct diagnosis? And patients have reported on this for some time, but this will be a quantitative study to determine how many patients get the wrong diagnosis and what happens to them as a result of that. Dr. Mark Hallett at the NIH and the National Institutes of Health is also looking for genetic markers for focal dystonia, and he's comparing this in people with spasmodic dysphonia to people with other types of dystonia to see if there's a relationship between those. And finally, I want to talk about something that I've been involved in, the Dystonia Coalition, which started in the fall of 2009. This is a very large grant providing infrastructure and environment for many different investigators studying different aspects of all of the focal dystonias, including spasmodic dysphonia, torticollis or cervical dystonia, blepharospasm, some of the other dystonias. And as part of that big umbrella study, we are doing what's known as Clinical Project 3, which is trying to develop a definitive test for diagnosing spasmodic dysphonia and for discriminating it from other voice disorders so that people can get diagnosed early and accurately when they first show the symptoms of the disorder. This is a 5-year study. We have 4 centers. The centers are at Emory University, Washington University in St. Louis, the Medical College of Wisconsin in Milwaukee, and Mayo Clinic in Scottsdale, which is the last center to join us and will be starting in the next month or so. Each one of these centers are testing patients with 4 different types of disorders, either spasmodic dysphonia, patients with tremor, patients with muscular tension dysphonia only, and other voice disorders such as vocal fold paresis. And what we're trying to do is develop some gold standard diagnoses of these patients and then test our new measurement techniques to see if they are able to be as accurate as our external judges. And we had 2 otolaryngologists who are internationally famous for their knowledge in spasmodic dysphonia, and 2 speech pathologists who also have the same knowledge of and expertise in diagnosing spasmodic dysphonia. And they are sort of the gold standard. But we found in the first couple of years that not everybody agreed on the diagnosis of spasmodic dysphonia, and some of our external gold standard reviewers both didn't agree with each other, and they didn't agree with the diagnosis that was given at the local clinic of these 4 centers. So because of that, because we found there was so much disagreement, at least 50% of the time people disagreed on the diagnosis of spasmodic dysphonia, that we had to take another approach. And what we're trying to do is develop a consensus definition of diagnosing spasmodic dysphonia across the country in the United States. And this is called the Delphi method. This is a method of developing a consensus definition. And it's been used in many procedures where you don't know the answer, such as forecasting the weather, for instance, asking 50 experts what they think their forecast is and trying to find out what the consensus is from those 50 experts. This is also done in medicine recently for trying to come up with consensus diagnoses or consensus ways, agreement for how to manage different disorders. So what we're doing over the next 6 months, and this process has already started, is illustrated here. We have 3 rounds. First of all, we're having each of the teams that are participating in our study list all the attributes that they feel are essential to diagnosing spasmodic dysphonia, tremor, muscular tension dysphonia, and other voice disorders. These different teams have contributed all the attributes, and we're consolidating those attributes now. Then we're going to take those consolidated attributes of what people feel are important for diagnosing these 4 different disorders and sending it out to experts around the country. We'll be sending it to at least 50 otolaryngologists who are part of the neurolaryngology study group, and at least 50 speech pathologists who are going to be at the national meeting next week. And we're going to ask them for their rank ordering of these attributes so that we can determine what everybody agrees are the most important attributes for diagnosing spasmodic dysphonia. Then we will come up with the final rankings based on all these experts, and we will then come up with a consensus diagnosis procedure for saying who has spasmodic dysphonia and who doesn't. And then we'll use that as the way of validating our new test for spasmodic dysphonia. This should allow us to come up with a consensus diagnosis that will be a big service to the field, because this can be distributed to everybody who is seeing patients with voice disorders. We'll be able to assess the severity using speech recordings and also identify which kinds of tasks are important when people examine the larynx using nasolaryngoscopy for diagnosing spasmodic dysphonia. So, to summarize what's going on in spasmodic dysphonia, a lot of activity. First of all, we're beginning to understand differences in brain function. There are several investigators looking for genetic markers that might put people at risk of spasmodic dysphonia. Several studies trying to identify diagnostic markers for determining who has spasmodic dysphonia and who doesn't. Ways of assessing the quality of life effects of spasmodic dysphonia. What happens to a patient with spasmodic dysphonia? How is their life altered by the disorder? Looking at auditory feedback and looking at sensory feedback in people with spasmodic dysphonia, and the excitability of different brain regions that might underlie some of the symptoms that occur. And then, as I mentioned, coming up with a diagnostic test for the disorder. How will this research possibly affect you? What will it do for you? It will help in the accuracy of diagnosis, so you can be sure whether you have spasmodic dysphonia or not. It'll differentiate spasmodic dysphonia from other voice disorders. By knowing that, we can begin to identify the genetic risk factors that might put somebody at greater risk of developing spasmodic dysphonia, and understand the brain function differences to try and understand how the brain produces symptoms of spasmodic dysphonia. That's important so that we can directly treat the brain abnormality that underlies spasmodic dysphonia rather than just altering the laryngeal muscles in a temporary fashion such as we do with Botox. And so by learning the basis for the brain dysfunction, we might be able to develop more effective treatments in the future.